Listen, do you hear the sound of high blood pressure? My name is Abril Valadez,
I'm Kayla del Bosque.
And I'm Jada Vaughn.
and today we're going to talk about the basics of blood pressure and whether or not hypertension correlates with heart diseases.
In this PowerPoint, we will be talking a little bit about adequate blood pressure, the effects of neonatal mortality, the treatments of hypertension, and the barriers and treatments for Hispanic ethnicity.
Our abstract contains the fact that the role of hypertension has been scientifically proven to be correlated with heart diseases such as cardiovascular disease. Now, why was this research conducted? This research was conducted to bring awareness to our community, especially because since we're in the border, almost all our reader population are Hispanics. And because we're Hispanics, we have a culture that involves food high in sodium, such as pozole, menudo, and tacos. On to our next point. Our hypothesis was right by following a timeline, and I will show you the timeline in our next slide. Month 1, we found articles pertaining hypertension and heart disease. Month 2, we answered 6 questions in a summary article assignment. Month 3, created our research paper in PowerPoint, and by spring 2021, hopefully we get to do some hands-on practice with our family members by taking their blood pressure.
To begin the introduction, we studied the importance of studying blood pressure is to maintain a healthy blood pressure. High blood pressure could lead to health issues such as strokes and heart attacks. Blood pressure is determined by the systolic pressure and the diastolic pressure. Maintaining a good blood pressure prevents you from having life-threatening conditions.
What's your adequate blood pressure? In this article, both JNC, which stands for 7th Joint National Committee, and ACA/AHA, the American Heart Association, American College of Cardiology, classified 120/80 as normal blood pressure. On the other hand, JNC classified 130 as pre-hypertension and ACC/AHA as elevated blood pressure. Brain experiment was made to prove that hypertension correlates with heart diseases. This trial included 9,361 patients with a systolic blood pressure of 130. After a 3-year follow-up, the trial was canceled due to decrease in myocardial infarction, stroke, heart failure, and cardiovascular disease.
Prevention of cardiovascular disease by the American Heart Association. In this study, they used the 7th Joint National Committee achieved the 2017 goal that prevents CVD events from occurring. The committee ran statistical tests which were calculated by the population size, which included patients aged 18 and up. All results run by the Joint National Committee were able to obtain the 2017 guideline goals within the 10 years they studied it. Joint National Committee prevented almost 71.9% of CVD events from happening. Treatment of hypertension and its relationship with cardiovascular disease. This article study was based on African Americans that deal with orthostatic hypertension, which is when you get up too fast and your heart races. Participants ranged in age from 18 years old to 70 years old. They reached their goal with the African Americans that had an SBP at their baseline. The intensive goal did not affect any postural change in the SBP.
Does high blood pressure affect neonatal mortality? So first we have NCDs. NCDs stand for non-communicable diseases. Prevention of NCDs are highly recommended during pregnancy due to severe complications for the mothers and infants, since they have a significant impact on infant mortality. Next, we have high blood pressure. It is important to care and maintain a healthy blood pressure throughout pregnancy and avoid it from being high. The chances of mortality in mothers with high blood pressure is 3 times higher than those with a healthy blood pressure. And lastly, we have the body mass index, also known as BMI. Maintaining a healthy BMI during pregnancy prevents you from the chances of neonatal mortality as opposed to those with a BMI of 30 to 35. A healthy BMI during pregnancy would be at 18 to 24. Does blood pressure change after ischemic reversal program therapy? In this study, it was divided into two groups, one of them being the normotensive group, meaning those with a normal blood pressure, and the group with elevated blood pressure. 22 out of 78 patients were found to be normotensive, as to the other 56 were found to be suffering from elevated blood pressure. After the ischemic reversal program therapy, the heart rate change in both groups and the diastolic and systolic blood pressure decreased in the group and elevated blood pressure, with elevated blood pressure, sorry.
Barriers and treatments for the Hispanic ethnicity. Now, like I've said before, us Hispanics have a lifestyle that increases our chances of getting hypertension. Studies were shown where Hispanics have more trouble with their health and their health care. In this research, a study named Behavior Risk Factor Surveillance System was conducted. It was a phone survey and 159,947 participants participated, and the percentages will be shown in the next slide. However, we can talk about the treatments and exercising and the healthy diet. A study was made for Latinos with hypertension and they performed in a study where exercise classes and the diet was given to them over the course of 6 weeks. Their systolic pressure was reduced by an average of 10.6. Behavior risk factor surveillance system percentages. 20% of Hispanic men from the age of 40 had their blood pressure controlled, and 21.9 Hispanic men needed to see the doctor but couldn't afford it at that time.
High blood pressure can be often prevented or treated by eating a healthy diet, exercising, and not smoking. Not maintaining a healthy blood pressure can lead to hypertension and cardiovascular diseases. Hypertension is known as the silent killer, but with early preventions, the risk could decrease significantly. The purpose of the study was to bring awareness to high blood pressure and see how you could prevent it. In 2021, we hope to test on patients and hope to see our results.
Next, we have our references that we used over the past few months in order to do our research. A couple more. And now we have our acknowledgments. We would like to thank Dr. De La Torre, MD and RN, Sabrina Rios, our research student mentor, Dr. Nora Garza, Vice President for Resource Development and Title V Project Director, Ms. Agüero Riojas, LEAPS Project Director, Ms. Gabriela Solis Cavazos, Undergraduate Research Coordinator, and the project funded by Hispanic Serving Institute, Title III STEM.